Swami Muditavadanananda. I was here in Dathathreya ashram and having my studies of our scriptures. 1997, at the end of that thing, I had a problem. I was just going to my bathroom, and then because the bathroom was wet, I just slipped, and then this all I know. So then what happened was that in such a way the fall was there, both the legs just went straight and hit the wall, and this head, this side, the latrine pot, so it hit it here. And then I became unconscious. I was just lying down, and then I don't know what happened. Then people just came after some 1.5 hours, and then they just, from there they took me, and then by the time my whole right side was not working, my legs, the right leg, right hand, all this portion,
the entire right half, the entire right half,
yes, was not working. And then even they were trying, poking the nails and tried, but I was having deep pain inside. If anybody pokes, I'm not able to understand, but from inside, very, very deep pain will be there. That also after 2 days I could realize all that. And then I was
conscious?
No, I was unconscious for some 2 hours, and then I was taken to hospital.
You could speak when you were conscious?
Yeah, I could speak, but I was unaware what is going on. I was not able to move my head.
Okay.
And then I was told that the head, it was turned to one side. And then one brahmachari just came and then he did like that now. And then some sound came. They said this is most dangerous thing. Then I was taken to hospital, and then so MRI was done, and then they couldn't get anything. Then they were to open my cervical spine, and so one doctor, our ashram doctor, and then she said we'll wait for a few days more, and then by that time they called our Dr.R.Raghavan, because Dr.R.Raghavan ji had treated our Pujya Swami ji before that, and at that time I was with him, helping him, preparing medicine and all the other things to get. This is how, and I had a rapport with him. Then when he got the news, he came, and I was told that midnight 3 o'clock he came to my hospital, and then exactly by 3 o'clock he saw the pulse, nadi, and he said that this is for this problem, medicine I have, I am looking for the patient. This is the first time. And then, so when I was little okay, at that time he said that you are so lucky that you have fallen down. This is a very unfortunate thing for a patient to listen to, but he said like that.
I mean, what did he mean?
He said that you are going to be so sound.
Because after this,
after this, yes, and then particularly this treatment what I am giving you, and then some.
But at that time you were still in the same condition.
Yeah, same condition.
And what did the doctors say?
Doctors, they were not able to understand. They said we'll have to wait and watch. So the MRI was not showing anything. And then still then doctors, they tried. Sometimes, and they may feel that maybe some psychological setback or something, or so they tried their level best, and then they couldn't understand. Then they said we'll have to watch, we have to wait, and then we'll have to open. And then again they were thinking to have MRI. Then they were just yet to decide that whether we should open the cervical spine and see. And
but there was no improvement with any of the treatments?
No. Allopathy treatment, I couldn't have that improvement. And
so the doctor was treating you while you were in the hospital?
Yes, yeah. And then our Dr.R.Raghavan ji came, and then he saw the pulse, and then he said, I am immediately sending this medicine. And then we are unaware of all other do's and don'ts, but he was telling that it should be given first in the initial day after 1 hour, then every after 2 hours, round the clock, 24 hours. So then I was given injections, all sedative and all that. So I was not aware of. Then they will just make me awake, and then I will open my eyes, and then they'll just take this medicine. So that medicine was some 30 milligram or 35 milligram to be taken, and that too with pure cow ghee. And then this first index finger should not be touched. If it touches, you should throw.
Oh, when you give the medicine?
No, when you in the prepare medicine, yeah.
Index finger should not touch?
Should not touch. You have to touch this third finger. And then if index finger is touched, then they say it becomes poison, so you have to throw it. And then he was telling it's very costly, so you be aware of.
Oh, he was providing the medicine?
Yeah. So all that I was taking regularly. While taking medicine, after some few days, and so I was feeling more and more hungry. Then he was telling me, you will have more and more hunger. I used to eat a lot.
Oh, as predicted, you
yes,
became hungry.
Eat a lot. And then Shirovasti every day, twice, and then oil massage. Oil massage also morning 2 hours, evening 2 hours. I have to just lie down in the oil only, and then.
He was doing it himself?
In initial days he was here. Then his son, Dr. Pradeep.
He continued.
His another son, Dr. Unni.
Yes.
He was also here. So they were treating me one after another. And I just tell you, in my case it worked out very well. And then after some few days I started having sensation.
Oh, I see. After this taking
yes. There in hospital itself, once this treatment was given, then started. It was some 6th or 8th day, then started having sensation. And still the neck was a problem, and then I was provided that collar, and then with that thing he was giving me Shirovasti. And then in the initial days, one person will sit and then will support with the 2 hands like this for 1 hour like that.
Or doctors?
Doctor, anybody else who will be there. Because I was not able to have the weight of this oil. It was such a painful. Then improvement started, and then this collar gone, everything gone. Then he was telling you have to take care of. You are not supposed to have any jerk. Don't bend down.
You were out of bed by that time?
After that, 3 months I was here taking medicine. After that I went to Gujarat.
Oh, you could move around?
Yeah. And then
the whole duration was only for 3 months?
Three and a half.
And you were
totally cured. So nothing. And then he was telling me, as the time will pass, you will see more and more strength. You will be more and more alert. The medicine is because he kept on telling that some 68 to 70 jadi buttis, so different herbal medicines are there, and because they will have a very good effect on my restoring capacity, and then memory improved, and I could see this.
Oh, it is true.
So this memory there is a tremendous improvement in that.
And general health also.
General health is so sound that even now I sleep for some 4 hours is enough for me. Like that I'm just getting the strength. And keep on doing. It was not there before that. It was not there like that.
So that's what he meant by it was blessing in disguise.
Yeah, and he was telling me, as the time will pass, you will see the medicine will be working inside.
And you are not on any medications now?
No more medication. In fact, he told me, even now also when I met, he with all love he scolded me that you were to take this medicine for 3 years, exactly on the tithi, the day you had fallen. Next year on the same tithi, again you should restart this medicine, and then Again, third year also you should stay for some few days, maybe his own calculation. That I couldn't do, I couldn't come from there. But even then, I feel that the treatment was given in such a way with all care and all that, and so I don't feel any problem. In fact, after the fall, I am more powerful. My memory capacity works like that, and then general health is improved. And whoever were taking, so I see in their all cases, so their general health has improved a lot.
And there have been other cases also.
Other many cases, many people were there. Even with me also, 3-4 people were taking medicines, treatment. And
so
Ashok Chabra is one of them.
Yeah.
So then Ashok Chabra was, he came here and he was taking treatment, and just recently I talked to him.
Yes.
And he was highly benefited. And another lady from Coimbatore, so Ramaji Menon, she was also, her general health is improved. And then like that, many people, a lot of people.
You were just talking about a person who was fasting.
Yeah, there was one person, Mr. Taylor.
Yes.
So Mr. Taylor, he was very old guy, and then something in Second World War or somewhere he was a pilot, and his listening capacity was totally damaged. And then he tried, he was telling, I have taken a lot of treatment but it didn't work. So Pujya Swamiji told him, why don't you come down to India and then come to my ashram? So we have an Ayurvedic doctor, he will help you out. And then Dr. Raghavan checked him, and then he said, yes Swamiji, this is a nervous problem and I'll be able to tackle this. And the treatment started, and Mr. Taylor day by day was improving. And then Swamiji used to talk very loudly with him because that short of hearing. So Swamiji went out, and some 2 months he went to States and all that. Then when he came back, by the time this man was improved like that, Swamiji shouted, how are you, Mr. Taylor? He said, Swamiji, I request you not to talk loudly. Now I am able to listen to. And he, very nice man. And then the improvement which we see in his case is also very good.
Dramatic.
He
had tried all other methods.
Yeah, he had tried. Then another Mr. Tom was there.
So he had multiple sclerosis.
So he was also having very peculiar problem. And then
you have seen him?
Yeah, yes. And then not only that, in one of the evening satsanga, so he was expressing his experience with Dr.R.Raghavan. He was very happy. And then it's nice. Dr.R.Raghavan.
Actually, he was incapacitated in some way. Tom, his symptoms.
He was having problems in his bones. He will not be able to stand. He was just like a hip. He will just go down. And then that he tried. He was telling, this is a disease where our modern medicine doesn't have any answer. And then he was having a letter that no modern medicine is going to work. That some letter was there in States, some certificate. With that letter he came, and
he's perfectly all right.
He was very good, and then he was expressing his gratitude in his satsanga for Dr.R.Raghavan. Yeah, our Swami Siddhabodhanji's mother also is his patient, and she also is benefited.
What was her problem?
I mean, a problem, some gynec problem or something. I'm not aware of that. But Siddhabodhanji used to tell that he is definitely, he has helped my mother.
Something about him as a person.
As a person,
yes.
Dr.R.Raghavan, I find it a person, nice person, the one who knows modern medicine. He has studied modern medicine also, and the one who is expert in Ayurveda, and so much faith in Ayurveda Shastra, and totally committed to Ayurveda. Not only he, his whole family. So I know all of them now. He is a strict person, very strict person. And so I used to ask him, Doctor, are you result oriented or treatment oriented? And even if I am okay, he'll say, no, you, according to Shastra, you should do this. So you must do. Shraddha. He believes in Shraddha so much. And I mean, I was very happy with him. In fact, because of him, I am now, so powerful, so sound. People who have seen me, they were telling that, Swamiji, your condition was so poor. And then they were in tears. So when they see me, first they ask, so how is your health? How is your neck? Are you able to move your neck properly? All that they ask. Even now also, people who see me, they ask. But that's why I have so much reverence, and then it's obligations of Dr. Raghavan. And as a sadhu, what can I do?
No. I just wanted to know. Because some people saying it's very difficult to follow his regimens. It wasn't that thing that I wanted.
That's true. That is always like that. Person when doesn't have any other solution, and then person understands helplessness. At that time, person will be ready to follow. Of course, he is strict. Sometimes what he thinks that must be done. And suppose you are able to win over his heart, then he will allow also. So he's that way. But in my case, he is 100% successful, 100% successful, and he is in my prayers. So that nice. I wish that more and more people should get benefited by him.